Hello. Good morning, Dr. S. Ranjan.
Good morning, madam. Good morning, Dr. Ratna. Good morning.
Hearty welcome to RVC channel. Very happy to receive you. And
Thank you.
I know
My pleasure.
we have been together for more than 25 years, including your great service to Lavanya Hospital here. That's how we came together. And now today's topic is also very good. Healthy heart, because September was a month for the heart. Okay, but people should take it seriously after knowing the facts that how they must include Ganoderma into their diet in the form of coffee or powder, capsule, everything has come now. And one more thing I want you to highlight, the part of cordyceps coffee, which is available in India right now for the heart, especially. Okay, because it works on all parts of the body. Okay, there's the people may not be knowing, because 6 months lockdown, we are not able to cover everything. Okay, that's why. So cordyceps, people must use it, in my opinion. Good for very good for heart, also the blood vessels. Okay, and your achievements is so many, because so many years you have done, and the service is not ordinary. It is servicing the engine of the body, that is the heart, and tolerating the stress of the patients and their relatives. Okay, when any heart problem comes, any comes from skin to bone, so naturally they will bother you. It is there. That's, of course, that's the service we as doctors are doing to the society. Okay, and we feel it our social service, actually. And so you are MBBS, after MBBS in MMC Chennai, then MD in cardiology, then DM specialization. And that is not all the thing. How many years of service you have given to these emergency patients? That's very important. That's what people remember. Doctor came 2 a.m., 3 a.m. So doctors means the profession is called as very noble, because doctors have to sacrifice many things. Sometimes 48 hours duty they have to do, and I know the society will appreciate it. That's why they give us a good salute for the nobility. Of course, in DXN you will have, it is a noble profession, and also it is a royal profession, because for settling the life. Okay, and I want you to highlight the daily products which are very good for heart. It is a first line product. It should be first line product, whether it is Ganoderma or cordyceps, a coconut oil. Okay, so you know that, and I don't want to extend, and I also want to hear you, because I am your student. Okay, so I was very happy that you have taken up healthy heart.
We are students,
Yeah.
because we are teaching each other right from the beginning.
Yeah. DXN has come
and the professor also.
Yeah. Okay, and I'm very happy to invite you to DXNRVC channel to enlighten our members who have taken the great strain of attending to this all the time, made it a point to be free in this time, and they are just, I request you to highlight them. It is a must that you must take care of the health, then everything will be taken care of. Health is the engine of our body, and that's so in China and Japan, because of Ganoderma, people live long, because of it is a tonic for the heart, and it controls the fat, blood circulation, nutrition supply, everything. You are going to talk, I know. Okay, doctor, now it is time for us to invite you, and all the people are waiting to deliver your precious lecture and new ideas and new information. That is very important. Every day, new information is coming because of experience. And we really enjoy your teachings. Okay, you are Mahaguru. For gurus, you are Guru. Okay, so once again, I invite you to this lecture session, RVC YouTube channel, and please do come often. It is your responsibility also. Now let us invite Dr. S. Ranjan, cardiologist to President of India, and he has done his duty very properly and painstaking, at the cost of his health also. That we should appreciate, because when we are all right, we don't feel it. When we have some aging problem, and we feel it actually, but without winking the eyes. So all the doctors above 70, they are doing service, and the DXN has given products to your hands. Please select the products for your care, body care, especially in this corona period. That is very, very important. Okay. Welcome, doctor. I welcome you.
Thank you, doctor. Thanks for the nice introduction. It's my pleasure. And today we shall share about some of the products which are going to help our heart to have a healthy heart. So, as you rightly mentioned, Dr. Ratna, DXN products are very beneficial to the entire body, and especially some of the products are very essential for a healthy heart. All of us know that heart is a very precious organ. We always call certain organs as precious: the brain, the kidney, the liver, the lungs, and the heart. So having a healthy heart is very, very important, and it's appropriate that we should think about the World Heart Day, which is celebrated 29th of September every year, to convey the message that we should take care of our heart. Actually, the World Health Organization, as well as the World Heart Federation, celebrate the Heart Day on 29th of September, but they have also mentioned that World Heart Day can be celebrated in any day during the month of September. So this year they have said that use your heart for the society and for your loved ones, and especially for you. So every year they give a theme to it. So this year also they have given this theme, that is use your heart to beat heart disease. As all of you know, heart disease is the #1 cause of death on the planet. It may be due to very many causes, but unfortunately, what is happening is we see a lot of young patients dying of heart disease in the past 10 to 20 years. That is very, very disturbing. We talk about the risk factors for heart disease, like smoking, diabetes, high blood pressure, obesity, and to this, the air pollution also contributes to the heart disease. Now, before going into the subject proper about the Ganoderma and the heart, I shall first narrate about the heart, why it is so special, and something very unique about the heart when compared to other organs. heart is a very powerful fibromuscular pump, and it is made of muscles as well as the fibrous tissue, so that it is empowered to pump the blood throughout the body, which runs into so many thousands of kilometers. Actually, it is said that our vascular system is around 98,000 kilometers. So throughout the entire the blood vessels, the heart has to move the blood. So it's a very powerful pump. At the same time, we should also understand that it's an emotional pump, because heart is the only organ which reacts to emotions like anger, stress, sadness, happiness, whatever it is, our emotions, it can affect the heart. And in my opinion, the anger is the worst emotion that we can have. So, because the anger can instantaneously kill a person. It can endanger life, because it is it causes great insult to the heart. And we have seen in our everyday life people dying suddenly when they become emotional. Something unique about heart is that it beats about 3 billion times, that is around 300 crores in a lifetime. Say approximately, if we take our lifetime as 70 years, it's about 3 billion times it is able to work without any rest. And it circulates the blood, as I mentioned, 90,000 kilometers of the blood vessels, the blood flowing through the such a vast amount of the blood vessels, the network of blood vessels. The normal heart rate is said to be around 60 to 100 beats per minute. When the heartbeat is less than 60, it is called as a slow heart rate. In medical terms, it is called as bradycardia. And if it is above 100 per minute, it's called as a tachycardia. So both bradycardia and tachycardia can be physiological or could be pathological due to disease conditions. So if one's heart rate is not within this range, then we have to find out what exactly is the reason. Blood is very vital for life, because blood delivers oxygen as well as nutrition to the entire body, all the cells in our body. So many trillion cells, about 37 trillion cells or 50 trillion cells. Yeah, all the cells in our body, they require oxygen as well as nutrition. So it is important for us to remember that blood is very, very important to transport these two vital nutrients to every cell in the body. And our health is primarily dependent on good blood circulation, both in macro as well as in micro circulation. Macro means bigger blood vessels, and micro means very small blood vessels, which are 1/100th of the thickness of the hair. So the heart has to pump such an throughout the body, it has to pump blood to the entire vascular system. So the vascular system is also very critical for the blood flow to happen. And if there are any blocks in the blood vessels also, that is manifested as very, very many disease conditions. As I mentioned, heart is an important organ in our body, unique organ. And we said that it pumps blood through the entire body. At the same time, it is equally important that heart also must get proper oxygen and nutrition. That is extremely important. So when nutrition and oxygen supply are decreased to the heart, then the heart starts failing, or many of the heart conditions can happen. Talking about the development of the human heart, it starts as a single tube, and it goes through various process of transformation, like torsion, folding, and this is one of the important organs which goes so many changes during the development in the mother's womb. So what the heart develops as a single tube, it becomes a four-chambered heart in the adult. And in spite of so many anatomical changes, the torsion, the twist, the heart is able to maintain its anatomy so well that congenital diseases are not common. So this picture depicts that as a single tube, the heart develops in the womb, that is in the child. By about 6th week or 8th week, the heart starts pumping blood and becomes a four-chambered heart. I've shown it below that the four-chambered heart in the human heart is four-chambered, and it has got 4 valves. So it is a complex anatomical structure. And if we talk about the blood vessels which are attached to the heart, there are 2 major blood vessels, the superior vena cava, which brings blood from the upper portion of the body, especially from the brain and neck, to the right side of the heart, the right atrium, and the inferior vena cava from the deoxygenated blood. Both these blood vessels, which are depicted in the blue, they indicate the impure blood, that is a deoxygenated blood. They get into the right atrium, the right upper chamber, then it goes into the lower chamber, the right ventricle, and the blood is pumped into the pulmonary artery. There is a valve guarding that, pulmonary valve, and there is also a valve between the 2 right-sided chambers, which is called as a tricuspid valve because it has got 3 leaflets. And the blood goes to the lungs, and in the lungs, it gets oxygenated. At the same time, the carbon dioxide is exchanged in the lungs, and you are breathing out carbon dioxide. That is one of the waste product, carbon dioxide. So it's extremely important that lungs should function normally, and it should oxygenate the blood, as well as it should detoxify our body by exchanging the carbon dioxide in the lungs so that it can be exhaled. So when there is any fault in this gas exchange, then there's going to be a big problem, in the sense that the reduced oxygen or an increased carbon dioxide in the blood damages the various tissues and cells in the body. And after oxygenation, the blood comes through the pulmonary veins. Pulmons means the lungs. We have 2 lungs on the either side or the chest cavity, and through the pulmonary veins. From the right side, there are 2 pulmonary veins, and from the left lung, there are 2 pulmonary veins, and they drain into the left atrium. And this blood, during the atrial contraction, it goes to the left ventricle, the left-sided chamber, and then it is ejected with tremendous pressure in the aorta, one of the biggest vessels found in our body. These 2 arteries are called as great arteries, the great vessels. So the blood is the oxygenated blood is ejected into the aorta, and it is distributed to the entire body, to the head and neck and the brain, and to the lower part of the body. So oxygenated blood essentially it comes to the right side of the heart, getting pumped into the lungs through the pulmonary artery, and there the oxygenation takes place, carbon dioxide is eliminated by the lungs, and then the purified blood comes to the left atrium, the left side of the heart, and it is pumped into the systemic circulation to all the parts of the body by the left ventricle. So basically one need to understand the anatomy so that how complex it is. And apart from this complicated the anatomical structure, we also have the special structure in the heart, which is called as the electrical system of the heart. There is a condensation of the special cardiac cells, which is called as a sinoatrial node. And this is called as a pacemaker of the heart. Because of the automaticity, the heart is able to contract in a rhythmic fashion, that is around say 70 beats per minute, that is 60 to 100 beats per minute. And this automaticity, it's generated by certain electrical currents generated in the sinoatrial node, and this electrical current passes down into the atrium in the atrioventricular node, which is again situated in the lower part of the atrium, and then it is conducted into the conduction system of the heart. This conduction system of the heart is also very, very important because the electrical current basically drives the heart in a systematic way so that the atria and the ventricle are they function in a normal sequence. So the electrical system of the heart is also very, very important, and the disease can also affect the electrical system of the heart. So the conduction system, the electrical system is called as a conduction system. It's a specialized cardiac muscle in the wall of the heart, and the conduction system has, as I mentioned, three components: the SA node, the AV node, and the bifurcations, the bundle of his, and the terminal branches, the Purkinje fibers. The Purkinje fibers are very minute, the specialized cardiac muscles. I've shown it here, right from in the ventricular muscle. So they are the real conductors of the electricity, which is generated by the SA node at the whole heart conduction system. And the heart has to into the great vessels. So if there is any problem with the conduction system, when there is a conduction delay, that can affect seriously the functioning of the heart, the pumping of the heart. So we have seen that heart has got anatomically it's a mechanical pump, very powerful mechanical pump, and also an emotional pump. And the electrical system also is very, very critical for the normal functioning of the heart. Looking at the characteristic features of the heart muscle, it has got rhythmicity. That is, it contracts in a regular fashion. As I mentioned, 60 to 100 beats a minute. And in times of requirement, when we do some exercise or running, the heart has to automatically increase the heart rate. So the rhythmicity is one of the characteristic feature of the heart. Second comes the automaticity. Heart is an organ which cannot be controlled by many factors. Of course, we know that there are some sympathetic systems from the brain, from the medulla, from the hindbrain, which can control the heart. But one of the important features is the automaticity. And the third important function is the conductivity. As I mentioned, the electrical activity has to be conducted in a systematic fashion, so that the heart has to contract normally from the outside to inside. And at the same time, it has got a very important characteristic feature of relaxation. The relaxation also is very important. And previously, we thought that relaxation of the heart is doesn't involve any energy. But today, we know that relaxation is extremely important. When the heart relaxes, it has to withdraw blood from the upper chamber, from the atrium, without increasing the pressure inside the heart. That is achieved by the systematic relaxation and the relaxation time also being extended. So when we talk about the contraction of the heart, it's around 0.3 seconds, and the relaxation takes 0.5 seconds. So the contractility as well as relaxation is called as cardiac cycle, one cardiac cycle, and that is approximately 0.8 seconds, that is 800 milliseconds. That's really amazing how this heart can function effectively during that very short period of time. So it is controlled by the autonomic nervous system, that is from the brain, the vagus, and the sympathetic nervous system. Both they are called as the autonomic nervous system. But ultimately, the heart is so unique that it beats on its own, and there are various centers in the brain, that is, as I mentioned, in the medulla oblongata, that is a hind brain, which are the center, the cardiac center, the respiratory center, the blood pressure center. So many vital centers are placed in the hind brain. That is why if one suffers severe damage or an injury to the hind brain, then it affects these vital centers and it leads to immediate death. As I mentioned, the heart has to get its proper blood supply, and for this, there are two major arteries: the right coronary artery and the left coronary artery. So I'm sure that in this period you will be aware of this. What is corona? Corona means something like a crown. So these arteries supplying the heart, they are placed anatomically. They are placed something like a crown. That is why they are called as the coronary arteries. The right coronary artery, which supplies about the right ventricle and supplies around 30 to 40% of the heart. The left coronary artery, which arises from the aorta, from the left coronary cusp, it divides into two major blood vessels. That is a left anterior descending coronary artery and the circumflex artery. And practically 70% of the blood flow to the heart is supplied by the left coronary artery. That is why any block in the left coronary system is very, very critical. Of course, even the right coronary artery disease also can lead to heart attack or heart failure. But it is usually said the left coronary system is very, very important. It supplies almost 70% of the blood supply to the heart. So, and you have very minute vessels from these two major the blood vessels, right and the left coronary arteries, and these vessels also are very, very critical. That is, we call it as a microcirculation. There are so many branches, divisions, which supply throughout the entire thickness of the cardiac muscle, heart muscle. So the microcirculation is also very, very important, and it should not be compromised. And especially talking about the microcirculation, we have a disease entity called as the microcirculatory disorders. So microvascular disease. The heart can basically, the major vessels can be normal, both on the right and the left coronary artery, but these minute vessels can be blocked. Especially, it is said that it is very common among diabetic people, as well as due to aging. And there are so many collateral vessels which are running between these two arteries. So the arterial supply is very, very critical. There are three layers of the heart. The innermost layer is called the endocardium. The middle portion, the muscular portion, is called as the myocardium. And the outer layer, which covers the heart, that's also very important, and it protects the heart from very many infections or injury, or every time during it heart contracts, there is a pericardial fluid which lubricates the heart. So that's also, the pericardium is also very important. And actually all the three layers of the heart can be involved in various conditions. So the outer layer is also very, very important to protect the heart. So generally we talk about the blocking of the coronary arteries, that is the deposition of the cholesterol inside the heart vessels. I have shown it here, that the cholesterol being deposited, it's a bad cholesterol, the LDL cholesterol that narrows the blood vessels, and this ultimately leads to reduction of blood supply and leads to angina pectoris, that is the pain, chest pain on exertion, and goes on to that leads to heart attack. So it's something governed by the aging process. Of course, we have risk factors. Then the tendency to develop the heart disease in a younger age is very, very common. That is why we see heart attacks and heart diseases so much. It's very common in the young age nowadays. So of all the deaths, cardiovascular diseases takes around 31% of the total deaths all over in the world. That's a big number. So we should be extremely careful so that we should control the risk factors and take care of our heart. And talking about the risk factors, especially in the young people, it's due to high blood pressure, undetected high blood pressure, high cholesterol, then becoming a diabetic and young aging. And one other important factor is smoking. Even passive smoking is very, very injurious. And as I mentioned, the nutrition, improper diet, the malnutrition can lead to very many conditions affecting the heart failure, and obesity. And we find a lot of obese people nowadays. And there are so many studies, especially in the school children. And these studies show that at least 20 to 30% of the children, school-going children, are overweight. Up to 10% of the ideal body weight is called as overweight, and if it is above 20%, it is of the BMI ideal body weight. It is obesity, and morbid obesity, anything above 70%. So a lot of young children are now become obese. That is a risk factor for heart disease. So basically, this is about the endothelial function and how the bad cholesterol can be deposited in the blood vessels because of the free radical effect. It can the low density lipoprotein, that is the bad cholesterol, can be deposited by oxidizing that. It can get deposited in the blood vessels, and slowly that can become a block in the blood vessels. It can occur anywhere in the body, but especially as humans, we are prone to these blocks in the arteries, in the arteries supplying the heart, in the brain, in the kidney, and in the peripheral vascular system. So first it begins as a fatty streak, then there is a block happening, there is a lot of cholesterol deposition happening, and then it compromises the lumen of the blood vessel, and there are a lot of cellular interactions, and slowly the plaque grows, and ultimately it is expressed in terms of, say, 80% block or 100% block, depending upon how much the plaque has occluded the blood vessels. This is again a two-dimensional picture I have shown how this block can almost completely occlude the blood vessel. The normal vessel should be like this, totally free of any cholesterol deposition. And here it is getting blocked, and it can happen in a particular area or in throughout the entire the blood vessels. So that is it's very, very important. By doing angiogram, we assess the uh, the the blocks, the percentage of blocks, as well as how extent it is into the coronary circulation. So the blocking happens because of the aging process. So I always say aging leads to disease and aging leads to death. So the thickening of the arteries, which is called as atherosclerosis, where normally there is a cholesterol deposition, and this is an aging process, and this is triggered or hastened by various parameters like risk factors. Normally what we talk about, the high cholesterol, obesity, high blood pressure, smoking, so all stress. So all these factors will aggravate the deposition of bad cholesterol, that is an oxidized LDL, in the coronary arteries, and that is expressed as the blockages happening in the blood vessels of the heart, and that can lead to heart disease. So when we talk about the heart disease, not only the blood vessels can be affected, the heart muscles also can become weak, and the pumping function of the heart can be affected. We call it as a cardiomyopathy. The valves, I mentioned there are 4 valves in the heart, and these valves also can be affected, especially due to the aging process or by some infection, or what is common in the third world countries is the rheumatic fever. So previously, about 40-50 years back, the rheumatic fever is very common in the third world countries, but with the advent of the usage of antibiotics and preventing rheumatic fever, the incidence of rheumatic valvular heart disease has come down. I also mentioned that the conduction system is very important. If there is any problem or disease problem in the conduction system, either in the SA node, the pacemaker of the heart, or in the conduction system, it can lead to various forms of arrhythmia, irregularity of the heart. That also can become a very concerning problem, and we need to treat those conditions. The electrical instability of the heart, or when the heart becomes highly irregular. There are certain symptoms where if one gets a heart attack, it can classically produce a chest pain in the middle of the chest. It can also cause lightheadedness, nausea, vomiting, and rapid heartbeat, shortness of breath. You may feel very tired. So many sweating. So because of the sympathetic activation. So these are the classical symptoms. But what is disturbing is that, without these warning symptoms also, one can get heart attack. Actually, 25% of the people without any warning symptoms, they get the heart attack, and many of them die instantaneously. So defining the heart attack, when there is a 100% block in the blood vessels, then the portion of the heart muscle dies, and that leads to the damages of the ventricle, and this leads to either electrical instability, or it can lead to the heart failure. So again, talking about the risk factors, it's a high cholesterol we talk about, even though today there is a controversy about the high cholesterol, but we are giving these statins so that we keep the cholesterol under control. The high blood pressure, especially in the young people, high blood pressure, smoking, and stress. These are the 3 major risk factors for heart disease. And added to that, long-term diabetes also can affect the heart. It can affect the heart muscle, the diabetic cardiomyopathy, the muscles can become weak, and also it can lead to occlusions in that is a cholesterol deposition in the blood vessel of the heart, and lead to heart attack. because I have gone in detail, because you need to know about the anatomical part as well as the physiological function, so that one should be aware of how to protect your heart. Even though we have modern treatments, especially to dissolve that clot, like streptokinase, urokinase, retaplase, alteplase, all these drugs are used when person gets a heart attack. We use the drugs immediately to dissolve the clot and establish the blood flow, so that the damage to the heart muscle is minimal. Now we are doing balloon angioplasty, stenting as a first procedure. It's called as a primary angioplasty. That's mechanically dilating the blocked vessel by a balloon and putting a stent there. Sometimes it is a planned procedure after the heart attack to improve the blood flow. It's called a secondary angioplasty. So there are a lot of stents available, and especially if one gets a heart attack, as I mentioned, the heart can stop. And it is extremely important that we should revive the heart instantaneously within 2 to 3 minutes. So we can use the cardiac defibrillation, external DC shock, direct current shock. There are so many varieties available now today. And you can see all these defibrillators. Now, very commonly, they are installed in the airports, in the shopping mall, and many of the workers in working there in these malls or even the public, they are trained how to give a CPR, cardiopulmonary resuscitation, or how to control this, how to do this defibrillation with a defibrillator. There are many types of defibrillators available, and nowadays we have the pacemakers also, as well as the defibrillators also, which is implanted internally. It's called as an ICD, implantable convertible defibrillator, and that can be modified according to the patient's need through a radio frequency instrument. So the rate, the rhythm, they can sense the abnormal heartbeats, the ventricular tachycardia and ventricular fibrillation. It can give a mini shock. So one of the recent development is this defibrillators. So these defibrillators are, in my opinion, they are very important, and one should be able to handle this, especially training the common public to do a CPR, as well as to use this giving an electrical shock. So now all of us know that bypass surgery has become a standard therapy for blocks, but nowadays the incidence of the bypass surgery is coming down, because of we are doing more of angioplasty and stenting. We give arterial as well as the venous grafts, and we put the internal memory artery or the radial artery for the graft, because arterial grafts, they last longer, maybe 15 years, 20 years. So the preference is to put a arterial graft which almost the similar size of the coronary arteries. It's very disturbing to note that 1 billion people will die of heart disease in the 21st century. Out of 7 billion, 1 billion will die by 21st century. Of course, our population is also going to increase, and more importantly, the disturbing feature is that more of young people are going to die of heart disease. So it's extremely important that we should right time concentrate on the heart, and to have a healthy heart. The prevention is better than cure. And with the reference to DXN, we have a very powerful product, Ganoderma Lucidum, which is a very powerful heart tonic. And we have been using it for quite some time now. And in the traditional Chinese medicine, it is a very powerful heart tonic. And initially, I took some time to educate you about the heart, how heart anatomy is important. Understanding the heart anatomy is important. The function is very important, and what are the treatment modalities available. But the best thing is, the prevention. Prevention is better than cure. And if you consume Ganoderma, it is going to protect the heart. All of you know better than me about Ganoderma lucidum. It contains more than 400 ingredients, and these 400 ingredients are classified into adenosine, ganoderic acids, triterpenes, polysaccharides, and organic germanium. One of the important action of Ganoderma as a powerful antioxidant. It's one of the powerful antioxidants which can detoxify our body from these free radicals. The free radicals are very toxic substances which convert the LDL to a bad cholesterol, oxidized LDL, which gets deposited in the blood vessels and creates blocks. And Ganoderma is the most powerful antioxidant known to us. So when you consume Ganoderma on a daily basis, you can protect your heart. Not only that, as an antioxidant, it can also prevent diseases like cancer and also arthritis and other brain disorders which are related to this free radical damage. So first and foremost, it's very important that Ganoderma can protect the body, protect our heart by its powerful antioxidant effect. So this I mentioned, the oxidized LDL is deposited in the blood vessel and create block, and Ganoderma is able to prevent that. And as an antioxidant, if you compare Ganoderma to ginseng, it is 5 times more potent like ginseng. So American Heart Association recommends regular intake of antioxidants. There are a lot of other antioxidants also. Spirulina also is an antioxidant, and we have a lot of products in DXN which are antioxidants, which are natural, and consuming these products, it can protect the heart. But this most powerful product is a Ganoderma, which can protect our heart by its antioxidant effect. Another important action of Ganoderma on the heart is, as I mentioned, the heart has to get a proper blood supply, especially the microcirculation. There are 2 components, powerful components present in Ganoderma, the adenosine and guanosine. They have the effect on the micro and the macro circulation, meaning that both the bigger blood vessels and these very small blood vessels, and only through the microcirculation you need to get the proper blood flow, the oxygen transfer, the nutrition, everything has to take place in and out of the cell. So Ganoderma is so unique in that it has got a very high concentration of adenosine and guanosine. By improving the microcirculation and the macrocirculation, it can protect the heart. So it can help the heart to get a normal blood flow and protect the normal function of the heart. So blood flow is very, very critical. So blood flow usually comes down with an aging process. As you age, the blood circulation comes down. And to keep up the blood circulation, that is why we say that you have to walk for at least 30 minutes a day, so that your blood flow is adequate to every cell in the body, every tissue in the body, every organ in the body. So as you age, your blood circulation comes down. So it's extremely important that you should walk for 30 minutes. And when you consume Ganoderma, your blood circulation also protected, especially the microcirculation, because of the effect of adenosine and guanosine. And it has, in addition, Ganoderma has got an antiplatelet effect. That's an aspirin-like effect, which prevents clotting. That's an additional benefit. So a lot of researchers have documented that it's an antiplatelet. So that's one of the powerful effect of Ganoderma, the antiplatelet effect. So the third powerful effect of Ganoderma on the heart is that the ACE inhibiting effect. That is a angiotensin converting enzyme inhibiting effect. By this we mean that the workload of the heart is decreased because of this ACE inhibiting effect. The lanosterine triterpenes, the ganoderic acid fraction F, they have the highest effect of this AC inhibition. It not only reduces the stress on the heart, reduces the workload on the heart, and reduces the blood pressure. We call it as an afterload reduction. That benefits the heart, and the heart has got less stress when you consume Ganoderma. This is our textbook of cardiology, Braunwald's textbook of cardiology. And then there is a chapter in that, chapter 51, which is about the complementary and alternative approaches to the management of patients with heart disease. We talk about the holistic medicine now. So we have to include not only the conventional mode of therapy, not only the allopathy, which is very powerful, but we also need to help a heart patient through the complementary and alternative approaches. And in this textbook, they mention about two the products. One is the green algae. What is green algae? Green algae is a spirulina, because spirulina is rich in nutrition. Whatever the cell the requires in our body, all the 50 trillion cells. So the nutrition, there is very high nutrition in spirulina, and this nutrition, the vitamins, minerals, and trace elements, they give proper nutrition to the heart muscle cells so that they function normally. And they mentioned the Ganoderma lucidum. They talk about yoga, meditation, acupressure in this chapter, and it's very important to know that in our textbook of cardiology in allopathy, there is a mention about our products, both the spirulina and the Ganoderma lucidum, which can prevent heart disease and help heart patients. We talk about the cellular regeneration. There is a recent theory by which we are treating heart patients, heart failure patients. The regenerations of the cell can happen. You cut the nail, it grows. You cut the hair, it grows. You cut the liver, it grows. It has the capacity to regenerate. And like that, heart muscles also can regenerate. And that is one of the important properties of the heart muscle. And what Ganoderma does is that it can regenerate the heart. There are several toxins in the which can damage the heart. We need to be extremely careful. As I mentioned, the smoking cigarettes, it contains more than 6,000 chemicals. And the tip of the cigarette butt, it's around 900 degrees Celsius. And many of the components, the inhaled in the smoke, they are toxic to the heart. They can cause cancers and lead to heart attacks. So smoking is very harmful to the heart. Even the passive smoking, and I've seen a lot of smokers. They smoke in front of their pregnant wives. It's extremely ridiculous. People don't realize that.
Going to be
So I mentioned that about the high blood pressure, how it can lead to heart attack, high cholesterol, and the sugar also. The recommended sugar intake per day is about 5 grams, and invariably, whatever the soft drinks that we are taking, we are addicted to, they contain more than 30 to 35 grams of sugar. So kindly avoid sugar, and if you are able to use the natural sugar, it is fine. Even the sugar substitutes also, they are very bad. So when you talk about the prevention, we have to control all these risk factors: the diabetes, high blood cholesterol, high blood pressure, lack of physical activity, and obesity and smoking. So when you want a healthy heart, you have to concentrate on this, and you have to walk 30 minutes a day, or that's a recommendation by the American Heart Association and the World Heart Federation, and at least 4 days in a week, you need to walk 30 minutes a day, and that's how you can prevent heart attacks. As I mentioned, the cigarette tip is 900 degrees Celsius. There are more than 7,000 chemicals. The nicotine, which is present in the cigarette smoke, that constricts the blood vessels and throughout our body, right from from brain, from our eye, and all the organs. They receive less blood supply because of the vasospasm created by the nicotine. So cigarette smoking is very, very dangerous. That's one of the major reasons people getting into heart disease. And the World Health Organization has said that tobacco is responsible for 20% of the deaths from the coronary artery disease. This is young people population. So we need to remember that. And we talked about the regeneration, how the regeneration can happen when there is a dilated heart. When there is a regeneration of cells happening, it can actually reduce the size of the heart, and it can improve the effective pumping of the heart in a failing heart. So this is the latest the research information, and people are working on it. And based on this cell regeneration only, we are doing the stem cell therapy. We have not perfected it. I think it may take another 5 to 10 years for us to perfect that technique. And what is very important about this Ganoderma, unique about Ganoderma, is that it can cause cell regeneration. So when you consume Ganoderma for more than 10 years, you are supposed to get the power of regeneration. So your liver cells can grow, your heart cells can grow, and various tissue cells, they can grow. And ultimately, when you are aged, our cell population is kept constantly, and all the vital organs in the body they function normally. This is just to show you how this ACE inhibiting effect can transform into benefit. That is, it can normalize the blood pressure. And also the ACE inhibition, as I mentioned, it can reduce the afterload, the stress on the heart. And we give a lot of drugs now which can act on this system, angiotensin 1 and angiotensin 2. They are called as ACE inhibitors, angiotensin converting enzyme inhibitors. There are so many pills, lisinopril, perindopril. There are so many pills available. They act on this angiotensin 1. Now we have receptor blockers actually blocking the angiotensin receptors. The angiotensin 2 is an active component, and there are so many drugs acting on this system. So Ganoderma is powerful in producing this physiological and biological effect of blocking this angiotensin, so that this ACE inhibiting effect can protect our heart, reduce the workload on the heart. So the another additional benefit of this ACE inhibition is the insulin sensitizer, whereby it can help the diabetic patients also. And it is an anti-inflammatory, Ganoderma lucidum. There are so many inflammatory conditions of the heart. It can lead to cardiomyopathy, the dilated heart, failing heart, so many autoimmune disorders. They are due to inflammation. And rheumatic heart disease, as I mentioned earlier, it's due to inflammation. So Ganoderma, being a very powerful anti-inflammatory agent, it can protect our heart from all these inflammatory conditions of the heart. So this anti-inflammatory property of the Ganoderma is generally said to be due to the polysaccharide fraction. So Ganoderma, by preventing inflammation of the cells of the heart, it can protect the heart. And the Ganoderma can also prevent various infections because it's a very powerful bacterial and antiviral action, and also an immune modulator. It increases interleukin 1 and 2 and increases the immune system. So modulating the immune system, it can actually help in some other conditions like rheumatic heart disease and rheumatoid heart disease and various other inflammatory disorders of the heart. It's a very powerful anti-stress herb. We discussed about that. Stress is a major killer. So generally, it affects the heart more than any other organ by increasing the blood pressure and the heart rate and stress on the heart. The increased afterload of the heart, and then the catecholamines responsible for the this bad effect, the effect of the stress on the autonomic nervous system can damage the heart. And by Ganoderma, by acting on the brain, it has got a very powerful effect of calming the mind, and the stress can be relieved and the heart can be protected. When we talk about the risk factors, we talk about the modifiable risk factors like high blood pressure, high sugar, cholesterol, triglyceride, obesity, lack of physical activity. All these are modifiable. You can change it. So by changing our daily habits and our daily food habits, especially the food habits and the nutrition. We also talk about the non-modifiable factors. The non-modifiable factors being the aging. Aging, actually, we don't have any control. And but the beauty of Ganoderma is that it's an anti-aging. Being a very powerful antioxidant, it has got anti-aging properties. So when you consume Ganoderma, you can also take care of the aging process. I always say aging leads to disease and aging leads to death. And Ganoderma being a very powerful anti-aging, it can protect the heart in the age-related illnesses. Actually, in the Western society, the age-related heart failure, heart rhythm abnormalities are very, very common, especially after the age of 80 years. And the government is spending a lot of money for taking care of these patients because they need to get admitted in and out of the hospital. There's a huge strain on the government, especially in the Western countries. So it's absolutely important that we should stay healthy and have a healthy heart. So aging heart, as I mentioned, it can lead to heart failure, various types of abnormal rhythms, the arrhythmias, and even though we have medications, very powerful medications, and we have the implantable cardiac defibrillators and pacemakers to control our rhythm, but it's wise, I think, we prevent such disorders. The regeneration, we talked about how powerful the Ganoderma is important to regenerate the cardiac muscle, also to regenerate the blood vessels, especially the microcirculation. We call it as a neovascularization. So that is one of the powerful effects of Ganoderma. And today we have a lot of drugs like statins, aspirins, antioxidants, and we should remember that Ganoderma is something like a poly pill, which has got all the benefits of statins, aspirin, and the antioxidant, especially in the area of prevention, as well as also it helps the heart patients. So we call this as a pleiotropic effects of the drug, or now we can say the Ganoderma because it's beneficial to the heart in health as well as with the heart patients. So when you consume Ganoderma on a daily basis, we can prevent heart disease, we can help a lot of heart patients. The next product is a spirulina, and as I mentioned, heart should receive proper nutrition, all the micronutrients. So our spirulina is a world-class spirulina. We have all the standard ingredients in that. We have 65% digestible proteins, vitamins, minerals, and trace elements, because spirulina also is an antioxidant, meaning that it can protect our body from the free radicals and also help in cardiac patients. So I have shown the documentation in my textbook of cardiology about Ganoderma as well as spirulina. So the green algae, nothing but spirulina, and one should consume our spirulina on a daily basis, at least 2 to 3 grams per day. That is around 6 to 10 capsules of spirulina every day, so that we can protect our heart. The other important product is that cordyceps. The cordyceps, it's supposed to help in protecting the heart as well as the vascular system. The vascular system is very, very critical. The blood flow has to happen both in the micro and the macro circulation. So cordyceps is especially very powerful in protecting the heart as well as the blood vessels. So we have cordyceps coffee. So kindly consume cordyceps coffee on a regular basis so that at least you are able to get some amount of cordyceps. I'm sure that once the Siddipet factory is open, we will get the cordyceps. And I've been repeatedly requesting the management to give us cordyceps and lion's mane. Lion's mane is very good for the nervous system. It improves the production of nerve growth factor, NGF. And apart from this, these benefits to the heart and the blood circulation, it can maintain our immune system, kidney function, liver function, and also maintain the cholesterol and regulate the hormones, especially in the ladies. So cordyceps is a very powerful product. So I want all of you to at least use cordyceps coffee on a regular basis so that you can protect your heart and have a healthy heart. This is one of the recent journals, the Indian Heart Journal, publication in 2018-2019, September 2018, full article on Ganoderma lucidum. The role of polysaccharide peptide of Ganoderma lucidum as a potent antioxidant against atherosclerosis, meaning the blockages of the arteries, and in stable angiopathy, that is a heart patient. So full article. It's a 6-page article which has come in our Indian Heart Journal. So I have shared this on many occasions to our DXN family in my presentations as well as to many of my cardiologist friends. But they will not consume Ganoderma. I don't expect them to do it also, because they always, they will prescribe only medications, because our allopathic system of medicine is all about dealing with medicines. So this is about the heart muscle, which can primarily get involved. It can weaken the heart. These are the current treatment for heart conditions. I talked about the various medications and angioplasty and balloon dilatation and the stenting and surgery. You would have heard about it. And we also do open heart surgery to close some of the valve, repair the valve, replace the valve, also hole in the heart, and some of the complicated diseases like blue babies. And that is also can be corrected with the heart surgery. So unfortunate that some of the children, they are born as blue babies. So they need to be operated. And this is one of the most advanced what shall I say, invention what we have done. The scientists, it is a portable heart. This woman is carrying a portable heart. He is carrying in his back. This is only as a temporary solution before the patient can go in for a heart transplantation. So this is very, very expensive, very expensive. And probably, in my opinion, I'm thinking is it should cost more than 1 crore, and everybody cannot afford. And then all the other organs should be healthy, so that this sort of treatment modality can be given. And we have an advanced blood circulation system also. You should have heard about ECMO, extracorporeal membrane oxygenation, and we can keep the patient alive for about 3 weeks, 4 weeks, till we can do a heart transplant, heart lung transplant. So they're all advanced treatment modalities. But most important thing is, we have to prevent heart disease. This is one of the books written by one of the very popular, well-known the cardiologist, Dean Ornish, Reversing Heart Disease. You can reverse the heart disease, healing the heart. And by healing the heart, I mean that through our diet, exercise, medications if necessary, and also taking our nutrition, DXN nutritional supplements, Ganoderma, Spirulina, and Cordyceps. Especially these 3 products, it's possible to prevent heart disease. And bypass surgery has become a standard procedure now. But there are natural bypasses in the heart. God has given that the collateral vessels. So when you take certain drugs or these nutritional supplements, so collaterals can open up these minute vessels that can supply the heart and strengthen your heart. And Ganoderma is that. The latest techniques, the open heart surgery, I talked about various treatment modalities, very complicated surgeries, and they are for mainly for children or adults who cannot be managed with the drugs alone. I'm quoting one of the great the cardiac surgeons in the 60s. He has done more than 150 heart transplant. He is the pioneer of heart transplant surgery. And this Dr. Christian Bernard, he is from South Africa, and later in life he was unable to do cardiac surgery because of a disease called rheumatoid arthritis. And he is a pioneer of the heart transplant surgery. And now of course, even in our country, we do so many hundreds of thousands of heart transplants. It has become a standard procedure for failing heart, which cannot be helped with the drugs or any other modality of treatment. And to quote Christian Bernard, he said, "I have saved lives of 150 people by heart transplant. If I had focused on preventive medicine earlier, I might have saved 150 million people." That is a thing we are doing through DXN. We can prevent not only heart disease, we can prevent so many diseases due to aging process with through our powerful products, especially these three powerful products for the heart: the Ganoderma, the cordyceps, and the spirulina. So I want every one of you to think about it, how our heart is very, very important, very vital to our body and for our everyday life. And 29th September is celebrated as the World Heart Day. In my opinion, you can celebrate World Heart Day every day in a year. And if you want to protect your heart, you should consume our DXN products, these three products, so that the theme of use heart to beat heart disease. First of all, you should love your heart, and also you should have a healthy heart. Not only a healthy heart, but a noble heart to help people. That's very, very important. So DXN requires a noble heart. The nobility is very important. So when you get associated with the DXN, that means you are a noble person. You want to help somebody. So financially or health-wise. So that is what my experience in this 20 years of my journey in DXN. So at this juncture, I want to thank. I'm so grateful to my very close friend, my family friend, Professor Vaspalaya and Dr. Ratna, for getting me involved in DXN. And I think, in my opinion, my journey in DXN for the past 20 years have been very, very happy and enjoyable. And I'm every day I'm enjoying this journey in the DXN. And I want every one of you to enjoy this journey in DXN. For all this, we must be grateful to our CEO, our beloved CEO, Dr. Lim Sujan, for giving us this DXN to us. And also, we must thank Professor Vaspalaya and Dr. Ratna for bringing DXN to India and helping millions of people all over the world through RVC and the DXN system to help people to be healthy and wealthy. So thank you very much. And I thank the Professor Vaspalaya and Dr. Ratna for giving me this opportunity to talk to you today. Thank you very much. Thanks a lot. Thanks a lot. Stay healthy, stay safe.
Thank you, sir. Thank you for such a fantastic. It was like as if I am in a medical college. if you admit, because you have gone so technical, so deep. Sabi, I think a few words I will translate that into. They are expecting Agarwal and all a gist of your today's session. अभी तो डॉक्टर साहब ने इतना हमको बताया एज इफ हमने मेडिकल कॉलेज में बैठा होंगे, इस तरह हो गया आप सभी। मैं टेक्निकल एस्पेक्ट को डॉक्टर साहब का आज का गैनाडर्मा एंड हेल्दी हार्ट के बारे में मैं नहीं जाऊंगा, बट ये फ्यू हाइलाइट्स इसमें जो डॉक्टर साहब ने बताया 300 करोड़ टाइम्स हमारा हार्ट हमारा लाइफ टाइम में बीटिंग होता है। 300 करोड़, इमेजिन 300 करोड़ टाइम वो बीटिंग होने के लिए, एवरेज बीटिंग लगभग अप टू 70 इयर्स, हमको कैसा वो उसको स्टॉप नहीं कर सकता है। धड़कना
without rest, professor, without rest. Yeah,
विदाउट रेस्ट ये हार्ट बीट धड़कने के लिए हम कैसे उसको हेल्दी रखना, आज इसने हमको सिखाया है। अभी इतना अमेजिंग एस्पेक्ट इसने बताया, आप सभी को डेफिनेटली मालूम नहीं होंगे। हमारा ये हार्ट का नेटवर्क, हमारा डीएक्सएन का नेटवर्क नहीं, हार्ट में नेटवर्क, ये वेजल एंड हार्ट सर्कुलेशन के लिए, माइक्रो सर्कुलेशन के लिए सभी नेटवर्क हमारा शरीर में हार्ट तक लगभग 90,000 किलोमीटर का नेटवर्क है। ये ब्लड वेजल्स का नेटवर्क 90,000 किलोमीटर। इमेजिन व्हाट ए अमेजिंग पंप, दिस इज ए पंपिंग स्टेशन, सच ए अमेजिंग पंपिंग स्टेशन को भगवान ने हमको माँ के गर्भ से बनाकर बाहर भेजता है। हमारा हार्ट बीट स्टार्ट होता है हम पैदा होने के पहले माँ के गर्भ में, एंड इसको कैसा रेगुलरली न्यूट्रिशन एंड ऑक्सीजन को हम सप्लाई करना, हमारा पोषकांश का कमियां हो गए तो कैसे हार्ट के ऊपर प्रभाव डालेंगे, इसके बारे में बहुत अच्छा सभी एग्जाम्पल के साथ बताया है। ये बहुत हार्ट डिसीजेस बहुत बरस से अभी डिफरेंट हार्ट, हृदय का रोग, उसको आज बहुत कुछ रिसर्च चला है। ये हृदय का रोग को हमने रोक सकता है, बहुत कुछ रोग को रोक सकता है। हार्ट अटैक को हम रोक सकता है, हार्ट का ये ब्लड सर्कुलेशन प्रॉब्लम को जो बुढ़ापन में आता है और डिसीज से आता है, डिसीज दूसरा डिसीज से बहुत कुछ रोग हार्ट को आता है, लाइक डायबिटीज, ब्लड प्रेशर, स्ट्रेस, लाइफस्टाइल का कारण से, स्मोकिंग से, इसके बारे में सभी डॉक्टर साहब ने बहुत डिटेल बताया है। ये हार्ट बीट हमारा मदर का गर्भ से शुरू होने के बाद हम मरने तक कंटिन्यूस ये ऑटोमेटिक प्रोसेस है। ये ऑटोमेटिक प्रोसेस को हमने कैसे प्रोटेक्ट करना, ये कैसे ये ऑटोनॉमिक नर्वस सिस्टम ब्रेन से ये हार्ट का फंक्शन के लिए कैसा मदद करेंगे, इसके बारे में भी बहुत डिटेल से डॉक्टर साहब ने बताया है। एंड हार्ट को मजबूत रखने के लिए, अच्छा रखने के लिए, स्वस्थ रखने के लिए, सेफ रखने के लिए, उसका सिक्योरिटी के लिए, हार्ट का सिक्योरिटी के लिए बहुत बढ़िया चीज है अच्छा खून की बहाव, गुड ब्लड सर्कुलेशन। वो खून की बहाव बहुत अच्छा हो गए तो हार्ट को अच्छा खून मिले तो क्वालिटी खून मिले तो क्वालिटी, और नॉट ओनली सर्कुलेशन का बहुत जरूरी है, अच्छा खून का जरूरी भी है, बिकॉज ये अच्छा खून नहीं हो तो पानी खून में हो गए तो बहुत कुछ हृदय का रोग उससे भी आ सकता है। ये मैक्रो एंड माइक्रो सर्कुलेशन के बारे में बताए। ये माइक्रो सर्कुलेशन हमारा ठीक नहीं हो तो कैसा ये वैस्कुलर डिसीजेस आएंगे, हाउ ये हमारा हृदय रोग को वो कारण बनेंगे, इसके बारे में भी आपने डिटेल में बताया। और सभी के बाद में हमको स्वस्थ रहने के लिए, हार्ट को स्वस्थ रखने के लिए आज का अजूबा प्रोडक्ट है जो दुनिया का भगवान का जड़ी बूटी में नंबर 1, ये जो भगवान का तोहफा है मानव जन्म को, आज ये किंग ऑफ हर्ब क्या हम बताते हैं, गैनाडर्मा लूसिडम ने हमारा स्वास्थ्य को स्वस्थ रखने के लिए और हमारा हृदय को रीजनरेट करने के लिए, हृदय को रीजनरेट मरु उत्पत्ति कर सकता है। ये गैनाडर्मा से ये साइंटिफिकली प्रूव हो गया है। और हार्ट डिसीज को हमने रोकने के लिए हमको बहुत कुछ हमारा जीवन में लाइफस्टाइल को बदलना है। फर्स्ट हमारा बीपी शुगर को डेली 30 मिनट का वॉकिंग कैसे जरूरत है हेल्दी हार्ट के लिए, इसके बारे में भी बताया है। और स्ट्रेस एंड टेंशन हम कम करना है और बैड हैबिट से दूर रहना है, मेनली स्मोक। मोस्ट ऑफ द यंगस्टर्स आज हार्ट अटैक लगभग 20% हार्ट अटैक आज ये स्मोकिंग रिलेटेड है। ये बहुत बड़ा एक चिंताजनक समस्या है आज का युवजन का, इसके बारे में भी आपने बताया। और ये 21st सेंचुरी में लगभग 100 करोड़ लोग मरेंगे बिकॉज ऑफ द हार्ट का हृदय रोग के कारण से। वो लगभग 20% दुनिया का पॉपुलेशन है। ये भी बहुत बड़ा चिंताजनक का सिचुएशन है, उसको कंट्रोल करने के लिए एज पर द WHO। और आज बहुत कुछ टेक्नोलॉजिकल चेंजेस भी ड्रग्स में, हार्ट डिसीज को कंट्रोल करने में, ऑपरेशन में और हार्ट ट्रांसप्लांट तक बहुत हमने टेक्नोलॉजिकली फॉरवर्ड हो गया है। वो होने के बावजूद भी हमको आज का बहुत जरूरी है, वो है हमारा हार्ट को नेचुरली स्वस्थ रखने के लिए। अभी ये लगभग 10 बरस हमने गैनाडर्मा लिए तो स्पिरुलिना, गैनाडर्मा, कार्डिसेप्स, इस तरह का नेचुरल जड़ी बूटियों को हम यूज करें तो 10 बरस कंटिन्यूसली यूज करें तो लगभग उसमें बहुत हमारा सेल्स का रीजनरेशन इंक्लूडिंग हार्ट सेल रीजनरेशन हो सकता है। ये हमारा आज का जो बहुत बरस से जो रिसर्च चला है, संशोधन चला है डिफरेंट मेडिकल इंस्टीट्यूशन में और साइंटिस्ट ने रिसर्च किया, इससे हमको सबूत मिला है। और बहुत कुछ इन्फेक्शंस एंड हार्ट का ये रोग से इम्यूनिटी को बढ़ा सकता है। अभी ये कोरोना का टाइम में आपको मालूम है ये बहुत बड़ा समस्या, ये इन्फेक्शन, वायरल एंड बैक्टीरियल इन्फेक्शन, इससे भी दूर रखने के लिए, हार्ट को प्रोटेक्ट करने के लिए हमारा गैनाडर्मा और DXN प्रोडक्ट यूजफुल होता है। ये तो एंटी स्ट्रेस है एंड एंटी स्ट्रेस इफेक्ट गैनाडर्मा में है। और हमारा सभी शरीर का वो ऑर्गन का बैलेंस करने में और रीजनरेट करने में, इंक्लूडिंग आवर शुगर, बीपी, एवरीथिंग, उसको और कोलेस्ट्रॉल सबको नॉर्मल लेवल में लाने के लिए ये न्यूट्रिशन का, माइक्रो न्यूट्रिशन का बहुत जरूरी है। ये है हमने आज DXN प्रोडक्ट से हम सभी उसका लाभ उठाना और ऑल द बेनिफिट्स ऑफ ड्रग्स नेचुरली ऑल द ये औषधों का जो हमको लाभ मिलता है वो सभी लाभ हमने नेचुरली DXN, गैनाडर्मा, मोरिंजी, स्पिरुलिना, कार्डिसेप्स, इससे ये सभी इस्तेमाल करने से हमको मिल सकता है। और हार्ट का अभी और एक बड़ा बहुत रिसर्च वर्ल्ड का, दुनिया का फर्स्ट हार्ट ट्रांसप्लांट सर्जन क्रिश्चियन बर्नार्ड ने 150 हार्ट ट्रांसप्लांट 1960s में, वो समय में वो फर्स्ट है हार्ट ट्रांसप्लांट का सर्जन दुनिया का। इसने लास्ट डेज में उसको रोमेटिक आर्थराइटिस से वो हार्ट ऑपरेशन नहीं कर सका। इसने बताया अभी हमने नेचुरल थेरेपी को मैंने गए तो नेचुरली हार्ट डिसीज को रोकने का प्रयास हम किया हो गए तो 150 का नहीं, हमने 150 मिलियन लोगों को बचा सकता है बताए थे। ये लगभग 70 इयर्स के पहले 1960 1920 टुडे ऑलमोस्ट 60 इयर्स के पहले, आपको मालूम है 60 वर्ष के पहले, आज हमारा हाथ में गैनाडर्मा है। नेचुरली हम बहुत कुछ रोगों को रोक सकता है। नॉट ओनली हार्ट डिसीज, हार्ट को कैसा ये आज जरूरी है, ये सिंगल ऑर्गन के ऊपर मैंने बातें किया, बट गैनाडर्मा का और डीएक्सएन प्रोडक्ट का और इस तरह का नेचुरल जड़ी बूटी का जो परिणाम हमारा बॉडी के ऊपर, ह्यूमन शरीर के वो हमारे शरीर के ऊपर जो प्रभाव डालेंगे स्वस्थ रहने के लिए, रोगों को रोकने के लिए और लंबी जीवन के लिए। अभी ये रोगों को भी नॉट ओनली रोगों को रोक सकता है, हमने लंबा जीवन रहने के लिए 100 बरस जीने के लिए रोगों से दूर रहकर उसको मदद करते हैं। इसीलिए मेरा अनुरोध है आप सभी के साथ, गैनाडर्मा को आप सभी यूज कीजिए, उसका फायदा उठाइए। ये इसे हमको ये मौका देने के कारण से मैं सबको, डॉक्टर लिमसियो जिनको और हमारा स्पॉन्सर प्रोफेसर सुपाल एंड डॉक्टर रत्ना को मैं बहुत आभारी हूँ। सी यू इन द नेक्स्ट सेशन। थैंक यू वेरी मच। ये तो वेरी जिस्ट में डॉक्टर का आज का सेशन का ट्रांसलेशन है माताडಬೇಕಾ?
Professor, heart is the only organ it will continue to beat even if you remove the heart from the body and keep it. No other organ. No other organ.
और ये तजुर्बा है, डॉक्टर साहब ने बताया एक ही ऑर्गन है हमारे शरीर में, ये हमारे शरीर का कोई पार्ट बाहर निकाल कर रखे तो, बॉडी से सेपरेट करके रखे तो वो काम नहीं करता है। एक ही ऑर्गन है, हम बॉडी से भी बाहर निकाल कर वो रखे तो वो काम करता है।
It will beat for 20 to 30 minutes.
वो हाफ एन आवर तक वो बीटिंग में होता है, दैट मीन्स हार्ट बीटिंग रहता है बताया। ये तो बहुत आश्चर्य की बात है।
Such a unique organ.
Yes.
Such a unique organ.
Unique organ. Such a unique organ, such a miraculous organ, बहुत अजूबा ऑर्गन है। इसीलिए आप सभी लोगों का अनुरोध है, DXNRVC यूट्यूब चैनल को 7 बजे को आप सभी इस तरह का स्पेशलाइज्ड ट्रेनिंग जो है उसका फायदा आप जबरदस्त नहीं उठाए तो आप क्राउन एम्बेसडर नहीं बन सकता है। ये महीने में अगेन मैं अनुरोध करूंगा, आप सभी ने, सभी स्टेट का लीडर्स ने, सभी जगह में आपने इस बार अब लोगों को रिक्रूट करने में, स्पॉन्सर करने में आपका सारा ताकत डालना। ये महीने हमारा इंडिया का स्पॉन्सरिंग टोटली डबल होना है, ये उद्देश्य हम काम करते हैं। आप सभी को मैं रिक्वेस्ट करूंगा, आप अच्छा कमाना है तो फर्स्ट आप सभी ने एटलीस्ट 20-30 लोगों को डायरेक्टली स्पॉन्सर करना, मेंबर लेवल से लेकर वो डायमंड हो, डबल, कहीं भी कोई भी लेवल में हो, आपका विड्थ को फर्स्ट मैक्सिमाइज कीजिए। उसके साथ टीम को डेवलपमेंट में टीम बनाना है तो आप डेप्थ जाना, रिक्रूटमेंट के ऊपर ध्यान डालिए, वहां से आपको अच्छा काम करने वाला मिलेंगे। विश यू ऑल द बेस्ट। गो क्राउन एम्बेसडर। गुड मॉर्निंग।
Thank you, Professor. Thank you, Dr. Ratna. Thank you.